This is Walt Fritz from Foundations in Manual Therapy, Voice and Swallowing Seminars. My primary audience for the seminars I teach are speech pathologists, but I think there's a lot of misconceptions and lack of information on the applicability and the relatability of manual therapy for the various disorders that the SLPs are working with and on. And I thought I'd take the next couple of videos to take a look at some of the research to basically support this work, to know that it's included in your literature. In some cases, it's been included in the speech pathology literature since 1980. But when it comes to head and neck cancer and dysphagia, there's a paper published in 2019 by Gintas Krishunas that takes a look at, it's a survey study, takes a look at the application of manual therapy for dysphagia in head and neck cancer patients. And what this study does is it takes a look at a fairly large sample of speech pathologists who are practicing and basically polling them. What are you doing? Are you using manual therapy, et cetera, et cetera. Now, I'm not going to read the paper to you, but I want to go into a couple of what I think are fairly important points with this. Krishunas in the paper talks about there's about a 50-50 split with SLPs practicing in the United States, that some see dysphagia patients reactively if the dysphagia develops after radiation therapy, while the other half try to intervene proactively to mitigate the severity of the problems. In terms of, there's a sort of a throwback here in the paper talking about, since SLPs already employ a form of manual therapy called laryngeal manipulation, it goes by a lot of other names for voice disorders, as well as some stretching disorders. It's not a completely new interventions for speech pathologists to consider, although in many cases it still feels pretty foreign. So they collected the respondents from three different listservs, serving 13,500 SLPs, and they got a response rate of 255. Of those respondents, 101 did not practice manual therapy, and 154 did employ manual therapy in the practice. What's interesting to me is of the 154 respondents that report they did use manual therapy in their practice, the majority of SLPs received training through a continuing education course or through on-the-job training from their colleagues. While the majority didn't receive manual therapy training that was specific to head and neck cancer patients. Now, I kind of see myself in that latter category because the work that I teach is broadly applicable. The same technique could be incredibly useful for head and neck cancer, trismus, or dysphagia, but also for voice disorders and oral motor issues, airway issues, etc. But it is good to see that a fair amount of those respondents have received training from, well, myself or a couple of the other really fine programs that are out there available for speech pathologists right now. When we look at the discussion, the use of there's a section of this paper that I really am fond of, and it's early days, but there's a part of the research that talks about how the regular use of manual therapy, and in this case they're talking about a combination use from therapists as well as home program, but that we might actually be able to mitigate some of the progression of fibrosis. Now, again, early days, but if you read through these couple of paragraphs in Krishuna's paper, you're going to read some of the background rationale for why possibly it might be advantageous to teach your patients to do this on a regular basis, more than once weekly, probably throughout the course of their life, to see if they can stem off the progression and the negative effects that often happen as a result of those that fibrotic advancement. The conclusion in this study is essentially more work is needed in terms of the timing, the dosing, etc. And they're talking about future papers, which I'm going to talk about in a future video too, that kind of leads us down the train of thought. Is this effective? Is it safe? Big important aspect of it, as well as what kind of outcomes we're seeing. So I hope you watch for a future paper or video that I'll do on that. But I do make this paper available to you. If you're interested, you can easily send me an email or a message from my website, from social media, etc., and I can forward this paper to you so you can have a look for yourself. 2019 paper, Krishunas mentioned sort of the paucity of evidence for the use of manual with head and neck cancer dysphagia. They reference their previous study, 2016. I'll talk about that in the future in terms of a small case study on the application of manual therapy during the course of fibrosis. But basically, kind of mention that we're short on good quality evidence, and that's something that needs to be done. But since then, I've got a few other papers that you might want to reference yourself to kind of catch up, as well as another paper that's going to be talked about by Daniels, which Krishunas is included in that.